Right now, the focus of research in Alzheimer's disease is in trying to identify people as early as possible. Because if we do have an effective intervention, it can do the most good early on. We can try to prevent the brain cell death that's going to occur if we catch it very early. Spinal fluid testing. Patients don't look forward to having a needle stuck into their spine and having spinal fluid drawn out, but that was the only method that was more foolproof that was funded by insurance. October 15th, it's an important date. This is the first time the Center for Medicare and Medicaid Services, the CMS, said that we are going to financially cover amyloid PET scan for the very early diagnosis of either mild cognitive impairment due to Alzheimer's disease or very, very early Alzheimer's dementia in cases where patients are considering and being considered for eligibility for the new monoclonal antibodies, like lecanemab. The first fully FDA-approved medicine for the disease, recently approved monoclonal antibody focusing on the plaque, this immunotherapy, intravenous treatment for mild or early Alzheimer's disease. It's a great step forward. There are very strict criteria about who can get this medication. But effective middle of October of this year, we now can do the amyloid PET scan that can give us a picture, a view of the plaque in the brain to confirm that, yes, we are dealing with maybe very early or incipient Alzheimer's disease, which we have available here at St. Louis University. It's only available in 2 places right now. It's at St. Louis U and WashU. We're not the only ones that have PET scanners. The problem is not the equipment. The problem is, we call it the ligand, is the tracer material that needs to be used with the PET scanner to light up the plaque in the brain. We have a cyclotron, and WashU has one. So the 2 academic settings have their own cyclotron. The cyclotron manufactures the tracing material that you need to administer IV, intravenously. It's a little minuscule tracer material to be used with the PET scanner to light up the plaques. That has to be manufactured, preferably on site. It has to be transported within an hour to a PET scanner elsewhere, because otherwise it loses its potency. And one of the issues that always comes up is, if the availability of these technologies is so limited, mostly to academic research institutions, how are we going to handle all those people? A patient this morning in clinic was someone with what we've diagnosed as having mild cognitive impairment due to Alzheimer's disease, which means that the beginnings of Alzheimer's disease have already occurred in the brain, but she's still highly, highly functional. She's driving, she pays her bills, she cooks, she does everything well. But her short-term memory is beginning to slip, and the family's noticed that, and she's noticed that. She's a prime candidate for the recently approved medication for Alzheimer's disease. But before she can get that, we also have to be definitive about whether she has the beginnings of Alzheimer's disease or not. So now I've got her scheduled for a PET scan. There's hope. There's hope.